Welcome to another episode of Project Safe, Seniors Against Financial Exploitation. It is estimated that between $25 and $30 billion a year is taken from seniors over the age of 60 and retirees. Retirees sometimes retire before the age of 60 and get included in that group. Within the town of North Hempstead, there's approximately 50,000 seniors and 20,000 retirees. That's 70,000 people. And it's estimated that 10% of them will be taken advantage of in the next 12 months. This is a staggering number, and this has nothing to do with people who are cognitively impaired. This is for every senior and retiree out there. The purpose of this program is to bring to your attention some of the tools and possible ways you can avoid being taken advantage of. I'm John Ryan, and my co-host today is Peter Janowsky, my partner. And it is my pleasure to bring to you Susan Lindner, who is a clinical psychologist, but more importantly, a life coach. And Susan's expertise is helping people navigate what they are feeling, how to get through life in their senior years. Susan, thank you so much for taking the time to be with us on this episode.
It's truly my pleasure, and I'm so thrilled to be here.
Great.
I really am.
How did you get into this field? I always ask, we try to break the ice with everybody, but like, how did you get into the field?
You know, I think that I always leaned towards the helping professions.
Okay.
I identified as a social work major when I was in college. Finished my degree, and then knew that I wanted to do a little bit more in terms of doing clinical work that would also support life coaching in a more comprehensive way. So I went on for my doctorate in clinical psychologist, became a clinical psychologist, and then found my specialty really working with geriatrics, which really, as you did say, anyone who has retired 60 and above, the older population, in terms of working with transitions and addressing issues that are just as relevant and sometimes even more of an imperative as we get older, and that sometimes it's not even spoken about.
Right. I just want you to give me a little bit better definition of clinical. I read it, and,
yes.
and I know what a life coach is, and I know what psychology is, etc. But for somebody watching this, clinical psychologist sounds very...
Well, you know, it's good to know that you're working with a clinical psychologist when you're doing life coaching for any domain of your life, whether you're in the early childhood development, whether you have children, or whether you're working with your parents, or whether it's for yourself, or for as somebody who's retired. Clinical basically helps the clinician and the life coach put together different skills and resources, and knows like where to grab. If you have a toolbox, let's say for example, here's the metaphor, you have a toolbox, you have a lot of different tools in your toolbox. If you're a clinician, usually you do have a good sense of which tool do you need to grab from that toolbox in order to provide resources for your clients.
Perfect.
To make the life coaching most effective and make it feel as if it really brings forth compelling change of what the client is looking for.
Okay, I've heard the term life coaching for years now. I never had enough nerve to ask.
Yeah.
So here it is. What is a life coach?
A life coach is someone who will sit with you and listen to what is driving your concerns. What are your issues? Tell me a little bit about your life. Let me understand life from your shoes, from your perspective, not from mine. I have a lot of tools and resources that I can provide for you if you're stuck. If you are at a roadblock in terms of you don't know if you need to turn left, turn right, or maybe do nothing. So I'm somebody who you can speak to and say, this is really who I am. This is really what's going on right now. These are my concerns, and I need some direction because this is, I would like to get to point A to point B, but I don't know how. Can you give me some support? And that's what I do.
And advice? Support and advice?
Advice is absolutely always provided, and that is with a qualifier that I will tell all of my clients. I will give you the best of what I have. I said you take what you need and leave the rest behind.
Right, because you're putting it into the seniors' hands.
I love that, yeah.
To make their decision. You're
Absolutely.
not directing them.
Right.
You're giving them the tools, as you just said.
The moment that I direct anybody, the moment I tell a client that I have the answers for them, the moment that I would pass judgments, that's when I'm not doing my job. And I would never do that. That's just not my, that's not where I position myself. I position myself from a place of empowerment and from a place of capacity and then building resiliency and building a sense of persistence and perseverance to get from point A to point B. And how do we do that collectively? It's a team. You and I would be a team. I go into my toolbox. I take out the tools that I have. I'll share them with you. And we'll see if we can put something together to help you get to your desired goals and objectives.
So when it comes to working with seniors, is there a common concern you find? Is there like a trend when someone retires or it gets to a certain age, or that change of life? It's something that you see, wow, I've been there, done that. It's common.
You know, I love this population because it presents with so many different life changes. There's a transition. What do I do when I retire from my career that I've had for 30 years? And what do I do with myself? How do I fill up my time? Transitions are usually a very big focus for this population. How do I transition my finances? How do I transition who's going to be responsible for me when I get older? How do I make these decisions? What do I do with my free time? How do I use my money wisely? How can I be cognizant of saying I do want to leave something for my legacy and for my children and my grandchildren, but how can I also be somewhat selfless and then also take care of me? Maybe I want that little condo in Florida. How do I mediate the anxiety that I'm feeling? Or maybe I'm feeling guilt that I should be doing this and I sort of want to do this, and how do we find the balance in the middle?
Right.
And there are always answers. There are always answers. You may not like the options in what the answers are, but there are always options. And until you go through the options that are available, I encourage everyone, don't make any rash decisions.
Right, I agree with you there.
That's what we tell our clients.
Right, that's the truth, though.
Don't make any rash decisions.
Not necessarily every option is what you want, but there are going to be a collection of options.
Yes.
And you're going to pick the best one that's accommodating, for what your needs are at that particular time. And that's where you're trying to send somebody.
That's exactly right.
Do you deal with grief as well?
Grief and bereavement are huge, yes. Yes.
A general question from a senior perspective, and this is what I try to get at all the time. How do you find seniors willing to share? That's one thing that we push all the time, Peter and myself, in different programs that we do. You have to share. I'm not saying at a group table at a luncheon your most intimate, secrets. Obviously, with someone like you, they have to be more open.
Yes.
But in general, how do you find? I find that it's difficult. You really have to work on a senior, and they're happy once they do it. It's they've, whatever that is, that something off their shoulder. The expression I can't even think. The burden off their shoulder, but that's
weight.
The weight off their shoulder.
Yes.
It's beneficial, but it's hard to necessarily get them all to that point.
I think it's important to develop the trust in any relationship, and then to share with your client that they have complete confidentiality, and that my ball is in your court, and I am only here to support you. And basically, what we discuss and what you disclose and what we decide on, it stays right here between you and I. What you do with it afterwards, that's your choice. That's your, there's your empowerment. But absolutely developing the relationship, and also providing some information for seniors and letting them know that they will feel better when they speak to somebody. Often there are feelings that come up of that they are betraying somebody or betraying a family secret, or there's some shame, there's some guilt, there's some remorse. How do you get past? Those are really intense feelings. How do you get past that and provide a safe place of acceptance for the reality of how they're feeling, and knowing that, okay, I'm sorry, I know you don't feel great. You're not feeling content and satisfied inside, that you have agitation. And I honor that, and I respect the fact that you're sharing it. But knowing that you have some agitation over this issue, what do you want to do? Let's figure out how can we move forward, and how can we find some options so you have less agitation, so you feel better, you are calmer, you have less feelings of shame and guilt and remorse, and we are more present focused. Not living in the past, present focused.
That's important.
Huge.
Because unfortunately, half the things that people deal with is so far yesterday.
Yes.
But they're still, it's as if it's sitting right next to them this afternoon.
That's right.
Every day, any morning when they wake up, etc.
That's right.
Again, and we're trying to do this from an educational point of view for our viewers. Somebody is coming to Susan, like the first session or two really is nothing more than fact gathering, excuse me.
It is.
People are going to step into this
room, my treatment room.
Okay, thank you.
Yes.
And you're going to be asking questions in the beginning. So I'm going from the point of view of a senior who's watching this. You're not walking in and bearing your soul the first day that you're not up for it.
No,
you're going to take step by step with Susan and at your comfort level. And
That's
as you trust the relationship that you've created with them, they will obviously tell you more and more, which is what they're there for, which is in order to get a benefit.
Yes, I tell them the more you tell me and the quicker you tell me, the quicker I can help you.
Right.
And then the sooner I can get you out of here. And then you're done with my services, at least for the moment. And I encourage them, though, to make sure that they feel comfortable with what they are sharing with me, that I am always available after we meet. And if they want to call me or text me, if something's not sitting right with them, that I am available for them. That just because they leave the room doesn't mean that they leave the client relationship as the life coach, the therapeutic alliance, however you want to define it, that I am going to be a support inside the room and outside of the room.
That's significant. I didn't realize that.
Before you touched on finances, I have a question. Do you come up with, is it common, I should say, to have situations where some of your clients are concerned or have anxiety, let's say when they lose a spouse and finances are involved? And do they become less trustworthy of other family members? Do they ever feel pressured? You ever seen any examples like that?
Could you clarify that just a little bit?
Like for in other words, if a couple if somebody loses their spouse,
right,
and let's say seniors, it's very common that we found that seniors, one of them will be the person that balances the checkbook. The other person has no clue. So now, once that person balances the checkbook is gone, all of a sudden, cousin Ralph comes out of the woodwork and says, "Hey, by the way, things are bad. I need $30,000 for a new car." And I mean, I'm assuming that with the age group you're working at, that may be common.
Sometimes it is, and sometimes it isn't. I have to tell you, that's just one of a different type of, excuse me, that's just one type of problem that presents itself when we deal with finances. Sometimes it is that our seniors do not know how to really manage their finances, and that's a very real problem for them. Okay, so how can I help?
Right.
I can provide them with, I know a lot of where there are some continuing education classes, referral services for seniors that are low cost or no cost, and helping them find out how to acquire skills. And this is where their comfort zone is pushed a little bit to the limit. Because sometimes if a senior doesn't know how to, let's say, manage their money or budget a checkbook, this is going to drive them to look at skills that they do not have inherent within themselves, and then figure out what do they need in order to move forward. They need some financial skills. They need to learn how to balance a checkbook. They need to know, like, when the bills are paid, how to pay them. If they don't know how to use an iPad or a computer, and the spouse was doing the bills online, what are some options if they're not, let's say, user-friendly with a computer?
We've gained a lot of, believe it or not, we've gained a lot of clients over the years simply because, oh my gosh, now I need someone to talk to.
Yes.
My husband's gone, I need help. Here's it spread out all over the kitchen table, what do I do? But I think it's a little different on your end because you're also dealing with advising them about the anxiety of it all, not just the physical part.
We normalize it because it is very normal to feel overwhelmed and to feel anxious and to feel that they're out of their scope of comfort. And I think addressing the fact that they are, let's say, anxious, or they're not comfortable, or they're not happy, or they're feeling overwhelmed is just part of the work. First of all, that's a normal feeling. So if somebody doesn't know that that's not normal, it is my job to let them know that you are going through what many other people have gone through, and you will get through it.
Right. Even no matter how hard it is to accept it.
Yes.
And people don't change their convictions or feelings overnight, so it's got to be Yeah, it's got to be some work involved.
So, yeah, and there are times, let's say you're speaking a lot about anxiety with finances. It could be anxiety with finances, it could be anxiety about, really, that's a universal feeling. But what transcends your question with finances is, what do we do when we have somebody who has anxiety? Well, we can refer them to their medical doctor, and there may be times where medication management may be necessary in terms of something short-term to hold somebody over. There are supportive groups, there are community resources, there's the library, there's lots of books. Someone like me, a life coach, will print out articles and I'll share it with my client. There is YouTube. There are websites. There are so many options.
Right.
And I will always say to the client, I know you're overwhelmed and I know you're anxious. We're going to get through it. It's not going to be necessarily easy, but we'll get through it. And you're going to end up getting everything that you need in order to bring you back to a place of both understanding and comfort. You're going to be okay.
That's wonderful.
And that's the truth. They're going to be okay.
That's important. What I want to go into is, for people that are watching this program, and you're sitting there looking at this saying, that doesn't pertain to me. Okay, now this is a tough question, and we didn't talk about this in advance. I'm not asking you for a list of issues that a person should come to you for. You know what I'm saying? Like,
yes.
People say, well, that's because my husband died, but I don't have that. I'm excessively overweight, or I have something else. That's not the issue that Susan's talking about. Pretty much any issue, but just to delineate some of them, because anybody could talk to you, technically.
Yes.
But we're trying to make this senior friendly and say, listen, pay attention to these things.
I have to tell you something. What I've been finding recently is I have a lot of clients coming in that have, over the years, swept a lot of issues under the carpet.
Okay.
Wow. That makes a lot of sense.
Okay? And here they are, they're coming in at 55, 65, 70, 75, 85. My oldest patient right now is about, I think, 97.
And it's time. And they're feeling it's time.
And I have to tell you, irrespective if you are 20-something or 80-something, if you have had a style of coping where you just decided not to look or to look away, or you swept it under the carpet, things that have been swept under the carpet tend to reemerge. Unresolved issues always come back.
Right.
It may be a different content, but the context is the same, that the issue remains. You don't know how to deal with your anxiety. You don't know how to deal with the fact that you just don't feel a sense of content, of satisfaction, life satisfaction. What do you do with that? What do you do when you don't feel a sense of life satisfaction? It's a tough question, because then
I think we could do a whole program on that. That's fascinating, yeah.
it's a huge, huge topic. When you do not have life satisfaction, this is when all of these issues that we've been touching upon, frustration, anxiety, shame, guilt, remorse, they all come to the table. Not at the same time necessarily, but they'll come to the table. And then, so a client who's coming to see me, I'll let them know, I'll say to them, I am solution-focused, reality-based, in the here and now. So we are going to look back a little bit to see what coping strategies, what you were doing in the past that really maybe served you well then, but maybe it doesn't work now. And then what type of coping strategies do we need now in order to help you move forward in the future more effectively and also happier. But in the meantime, as you do that, we are going to uncover, in order to get to A to B, we will uncover issues that have been maybe swept under the carpet. And it's going to be a little tough.
I was going to say, it's got to be difficult. It's like peeling away layers.
That's a real great analogy.
You've got to pay years and years of layers. Because I'm sure that every time somebody copes and does this, I'm not seeing it. It's another layer over it, another layer over it.
That's right.
And it's going to take time to dig.
It takes time to dig.
Yeah.
But sometimes when people come to me, especially the seniors, let's just say 55 and above, and they're coming to me, they are finally ready to look at what they've known all the time, and they just didn't want to look at it. They're finally usually ready. They're ready to dump and release and discharge and let it go.
Is it mostly with current relationships? Do you find if the people are coming in like after 25, 30, 35 years of marriage, and it's like it's time, the kids are gone? Is that common?
It's like I just said, the issues were always there, and they knew, but they didn't know.
Right.
And I've spoken to John about this previously, but I have a patient who blindly trusted somebody and lost all of her money due to somebody who basically, it was a scam, a senior scam, and she lost all of her money, and she sort of always knew that she wasn't good at managing it, but she never wanted to take control of it.
Is it like a family member?
Excuse me?
I can't ask too many questions. Was it a family member that scammed her?
We don't know that. I mean, most likely it might have been, but we really don't know that. And then we have, I have patients that come in, they've had marital issues for 30 or 40 years of their whole marriage, and they find out that their marriage was not as, it didn't have the integrity that they had hoped that it had, but in the back of their head, they sort of knew it didn't have integrity.
Right.
I mean, lots of different situations.
Many times, I believe, the person knows the answer.
Yeah.
Okay, and I'm not making light of anything.
You're right.
You know where you came from, you know where you're going, and you know the answer. It's just, you know, there's an expression that the flower comes when the bud can't take the pain anymore, or whatever it is like that. And that's really the truth. It's like,
true.
guess what? I want to get straightened out. I want to find a better way to live. I don't have to get up like this.
That's right.
And maybe it's the courage to talk with somebody like yourself that helps them. Yeah, you're just helping them find the answer that's already there.
That's all right.
You know, in a nice.
The truth of the matter is, they already know their answers.
Okay. Yeah.
The tough part, hearing stories about people getting scammed out of their money. I mean, that's what Project Safe is about. Unfortunately, when they get to you, it's done already. It's over, and you're dealing with the, for lack of a better expression, the mental mess of it all.
Yeah, it's financially exhausting.
Yeah.
It's emotionally taxing.
Yeah.
And it could drive somebody.
Oh, I'm sure you have. I'm sure you have terrible stories.
Yes.
And like we say it with when we give Project Safe presentations. Most people have a big feeling of shame. They don't want to tell anyone. No one wants to brag that, oh yeah, I was scammed out of $10,000. So, or that was taken by what trusting what they thought they were trusting people. Could have been a caregiver or something like that. We hear the stories all the time. But you're at the tail end of it.
I just don't want any confusion going there. People go to Susan for many issues, not just after a financial scam.
That's true.
Yeah,
that's right. Yes.
We're talking about financial scams, which is important. But you're not that go-to person after you've been scammed. You're that go-to person for any aspect of a person's life where they're not happy, basically.
When they're not happy, and helping them, helping them uncover their covered truths.
Okay. You got good words, or quotes, or whatever you want to call them.
Uncovered
Thank
truths.
Oh, yeah, it's the truth. Though.
But it's the truth, right?
Because that's what we find with our senior clients, and we wind up having conversations. It's not just financial. We wind up, uncovering lots of stuff. They level. Most of them are very honest.
We talk about life.
We talk about life.
Life,
which is important.
Family situations.
Family situations, and who they can trust and who they don't trust. Not to the level that you go to.
Yeah.
Because it's just not that kind of a private setting. But in order for anybody to move forward seriously. Anyway, in the direction of a dream, every issue has to be touched on.
Absolutely.
And you can't worry about your money knowing that you have a son or a daughter who hates you and it was your cause and you want to rectify it. Guess what? Back up, get that fixed, if you can. And sometimes they're not fixable. And then your job, I don't mean your job, but you would help the person then accept some things aren't fixable. That's, I guess then you have to accept what it is and move on.
You're right.
You did your best.
That's fantastic that you bring that up, because sometimes there are limited options.
Right.
And then we're like, okay, well, we really don't have a lot of options here, so now we have to go into acceptance, and how do you move forward from this place? But I tell everyone the truth will set you free. It's not. The truth will set you free.
Right.
Everybody knows their truth already. Everybody knows it. It's just so hard to look at it sometimes. It's gut-wrenching, difficult. And yet, at the same time, it can be the most liberating.
I was going to say, it's liberating. Yeah.
And the most wonderful feeling to be able to set yourself free from emotions that are trapped inside. They are toxic. They do not serve any purpose. Let them go, and let's just be free of it. Let's move forward without it. Let's move forward from a place of empowerment, from a place of feeling good and even and a sense of content right from the get-go. That's where we start.
Wow.
We're going to get better.
I'm going to have to watch this episode when it's over.
How long have you been doing this?
For about 22 years now.
Okay, my question is this. I'm not questioning how long you're doing
Yeah.
it. Do you find people today are more open than people 20 years ago? I mean, somebody coming to you is coming to you to be opened. I'm talking in general society. Are more people coming and opening up quicker because it's more acceptable than it was 20 years ago?
Okay.
And people are turning around and say, "Oh, I'm going to see Susan." 20 years ago, I don't think people would let you know they're going to see Susan. That's just my opinion. I'm not.
I agree with you. I have to tell you that it's really, there is a divide between the 21st century children, the millennials, and the 21st century versus anyone born 1970s and before that.
Okay.
The kids nowadays, I'm sort of actually, I'm a little bit jealous, to tell you quite frankly, that I wasn't born in this century, because now there is transparency, there's openness, there is a flow of information.
Which raises a level of comfort, too.
Level of comfort, acceptance. So if kids are coming in and they have issues, whether it's with their sexual identity, whether it's the divorced parents, whether it's that they're being
Totally agree with you.
bullied.
Very different.
Okay, kids are talking about it.
There's programs and opportunities in high schools 10 years ago that wasn't even thought of when I was in high school. I totally agree. There's resources for almost any age. I agree with you.
You know, the YouTube, the
very different.
Snapchat, the online resources, it's liberating. It's liberating. It's so, and for me, I just find it, I'm just thrilled that the younger people today have these opportunities to know who they are, to know what they like and they don't like, to know where they need help, to know that they have problems and they can find their answers.
And they know they're not alone.
They're not alone.
Right.
However, now that I gave you the positives, I will tell you that patients that come in to see me in even the late 20s, 30s, 40s, usually these patients can be very resistant. Not because they don't want help, they do. Everybody wants to feel better, so I'm not minimizing it. But our generation, or generations a little bit younger than myself or a little bit older, they do have a more difficult time, generally speaking, this is just a general statement, of looking at themselves and being able to look at the reality of what they don't want to look at, of what they don't like about themselves.
Still hesitant.
Hesitant not to come in. They're not hesitant to come in.
Right.
They're not hesitant to get help, but they're hesitant to look at what
the
they
process.
at what they don't want to look at.
Right, I get it.
Oh, what they don't want to like. Okay. Okay.
This is really a good talk. Unfortunately, we're winding down.
That's amazing.
So,
okay,
yeah,
great.
I got to be conscious of the time, otherwise I think we have to pay something. But,
A penalty. No.
Okay, I appreciate it. Thank you very much
it's
for
free.
having
It's public
me.
access. No, thank you for coming. And so I'm Peter Janowsky. This is John Ryan, and I want to thank you for watching. But most importantly, I'd like to thank Susan Lindner, who's a clinical psychologist and life coach. And we're Project Safe, which is Seniors Against Financial Exploitation. And if anybody wants us to present in front of their group, it could be a civic association, a friends group, church, or synagogue, just give us a call at 516-719-6396. Thank you.
Thank you so much for having me.
Oh, no.